So my talk of today is all about kidneys, in general, kidney-related issues, the problems by which the kidney usually get failed, and what we should do to protect our kidneys' health. I'm going to stick to the basics only. I'm not bombarding all of you with heavy words or medical jargon. Simple, basic tips, and I will try to take you to the wonderful world of the kidney and try to make it a point that kidneys are also equally important as your heart is. While the heart keeps the blood flowing throughout your body and keeps the function of all other parts of the organ alive, the purity of this blood is maintained by the kidney. If the blood is not pure, then the heart, if it delivers impure blood to different parts of your body, what will happen? You all understand. So the kidneys and the heart both are very important organ for to make your body going and going in a good way. So let's start my presentation now. So here we go. As all of you know, that our kidney, the two bean-shaped organ, they lie on the back of our body. There's the rough position of our kidney, the right and the left. The left one is little on the lower side, the right one is here. And if you remove the skin and then see that this is how the kidneys looks like, it's just supported by the ribs, the posterior ribs, and the resting just close to your spine. And if you see, the kidneys are surrounded, both kidneys are surrounded by so many other vital organs. You can see here the adrenal glands, spleen, then there is pancreas, then there is liver, then there are two major vessels called aorta and the vena cava that takes a good amount of blood to and fro from the heart. If you go a little deep, I'm sure many of you must be knowing about this, and they cut the kidney into half, and then try to understand it much better. You see that the kidneys are basically having two important the portion. You can say the outer and the inner one. Here in this diagram, you can see the outer one is little light in color, and the dark one, which is pyramid shape, it is little dark in color. The outer one is called the cortex, and the other one is called the medulla. The outer one is having lots of blood vessels, filtration happens here, and then all filter which get collected in the this pyramid shaped structure, which is called medulla. There are so many ducts, you can say pipe like a structure. All this duct ultimately opens into the calyx. You can see this yellow structure. These are called the major and the minor calyx. All whatever comes out from the kidney, it gets collected here and ultimately goes down in the form of urine. If you go a little more deep, you see this wonderful picture of photo. It's all the extensive network of capillaries, extensive network of blood vessels, so rich. The kidney is something which receives near about 20% of the cardiac output. Whatever your heart delivers in one cycle, out of that 20% goes straightway into the kidney. And to hold that much load, the kidneys are made in such a way. You can see such a beautiful picture. And somewhere there in the bunch of capillaries, you have this wonderful glomeruli. In simple terms, you can call it filter. So in the middle of this capillaries, the extensive network, you have millions of filters. The speciality of this filter, this unit, or it's called glomeruli, is this: it allows the water in the blood to filter out. In rest of the capillaries and other big vessels where the blood goes in and comes out, the water of the blood doesn't come out in normal circumstances. But this is these are specialized structure. It allows filtration to happen. It allows water to come out from the blood, and then once it comes out, and then there is the you can see the water filters, or the water comes out from this glomeruli, and it gets collected in a tubular structure. You can see there is long, the yellow color structure, whatever you are seeing. These are all long tubules. It collects the filter, whatever comes out from the glomeruli, and ultimately deliver it to the tip of the calyx. If you go close and see, this is the tip of the calyx from where the drops of urine comes out. This is the electron microscopic picture. And once it comes out from the kidney, it goes in a long tube called ureter, and from ureter it enters into a bladder, that's called the urinary bladder that you can see here. The urinary bladder collects your urine, and when the collection is more than say 200, 300 or 400 ml, then you start feeling pressure. And then once you have pressure and then ready to open or empty your bladder, thus the bladder contracts and the urine comes out through the urethra. So this entire structure is called the kidney urinary bladder system, the KUB. Quite often you must have heard about this. This is an amazing fact. You can see that kidney filters near about 120 to 125 milliliter per minute of water of your blood, you can say. So that makes near about 7,200 to 7,500 milliliter in an hour, or in a day it makes 17 to 18 liter per day. That's like something like 10 liters of bucket, and then 2 full buckets of water get filtered every day from your glomeruli, from your kidney. But what comes out is just 1 to 2 liters of fluid only. So near about 98%, more than that, sometime it gets absorbed. So this absorption of this 15, 16, 17 liters of fluid is the the most difficult function of the kidney. That's the reason the kidney needs more oxygen. The kidney needs more blood to flow in, and kidney needs more care also. Apart from filtration, which I showed you in my initial slides, filtration is a major function of the kidney, but it filters near about 18 to 20 liters of water. After filtration, then the tubules, I showed you the long structures, then they do final reprocessing. Then they see how much water to be absorbed, how much electrolytes to be absorbed, what is more in the blood. If that thing is more in the blood, that will not be absorbed or taken back from the filter. If something less, the kidney will try to absorb it. Suppose that your body has less calcium, and all calcium comes out in the urine, it's in the tubules, then kidney senses it. Then kidney will absorb calcium and then return it back to the blood. But if suppose your body has more potassium or calcium, whatever more in it, acid level is more in the blood, and whatever comes in the tubules, kidney will sense it, kidney will block its absorption, and everything will come out in the urine, the final urine. Similarly, kidney assess the level of water in your body. If water is more, whatever is filtered, 17, 18 liters of fluid, good amount of water goes out. If water is less, kidney tries to conserve. Even if 400, 500 ml of urine forms in case of severe dehydration, and the kidney will try to conserve as much as possible if there is water depletion or sodium depletion. So filtration is just a part, but the reprocessing of this filtrate, it's a very, very important part of the function of the kidney. And because of this, the kidney controls your fluid balance, your water balance, basically, and the level of salts or solutes in your body, primarily sodium, potassium, magnesium, calcium, phosphorus, acid, bicarbonate, uric acid, and all those things. These are all final products of your metabolism. Whatever you eat, whatever you drink, it get absorbed from the intestine, enters into the different parts of the body, primarily in the liver and the muscles, and then there it get metabolized. Whatever is required, tissue takes it. Whatever is not required, it given back to the blood. And once the tissue takes it, that process it, and then good portion is taken or eaten by the tissue, and the waste product which is generated, it is delivered back to the blood. And all this waste product then enters into the kidney. There it goes into the filter, and a final reprocessing happens. So this is the primary function of the kidneys: the control of fluid and the control of solutes. Apart from that, kidney does so many other important functions, like maintenance of your hemoglobin level or the red blood cells level. This is called the endocrine function. Here, kidney, there are some specialized structure in the kidney which makes an hormone called erythropoietin. That is very, very important for blood cells to maintain their lifespan. Apart from that, the kidney generate another hormone that is called the renin-angiotensin system, by which kidney tries to control your blood pressure. Kidney also metabolize, it's not only the food, it also metabolize many drugs which you take. So the metabolism of drug and its excretion is also kidney's main function. Apart from that, maintenance of acid and the base balance is also kidney's job. So it's not only a big filter which just keep filtering your blood and making urine. It is doing so many other. It's improving your blood. It's improving your bones function. It's maintaining renin, angiotensin, aldosterone system, maintaining calcium, magnesium, phosphorus, all those levels, maintaining acid-base balance, and so on and so forth. So once kidney fails and your all this works get hampered by some by the level of the kidney dysfunction, then what will happen? All those the problem you will face, these are all called the symptoms of the kidney failure. The primary the problem many of the kidney failure patients will have is retention of water. I just showed you 17, 18 liters of filtrate every day, and out of that 98% has to be absorbed. If kidneys are failing, this absorption power is the first which get deteriorated. So the patient, according to the level of the kidney dysfunction, they start retaining water, and once water gets retained, the patient will have swelling in and around their ankle or all dependent parts of their body, in their feet, on their face, and then once the retention is more, then it will get accumulated inside abdomen, then it will go into the lungs, and then because of this retention, because of that excessive water inside your body, then the person or the patient who is having kidney problem will start having all these complications like persistent cough, and he won't be able to lie down flat. He has to he will feel comfortable in sitting position because of water accumulation, and then there's sometimes excessive froth will come out of the lungs in the form of that is called pulmonary edema. And then because of excessive water retention, the blood pressure will go high. The patient will the heart rate will go high because heart has to function double to circulate this extra blood volume. And then patient will have, depending upon the excessive accumulation of water, different types of neurological symptoms. So this is one of the main symptoms of kidney failure or kidney dysfunction, water retention. And once the kidney failure progresses or the kidney function erythropoietic, that get disturbed. So the patient usually have anemia, that is the low blood cell count. Then formation of vitamin D is disturbed. Then there are so many changes in your bones. Patient will have bone pains. Then later on they would have bone deformity. That's called the renal osteodystrophy. And then less calcium absorption, the less vitamin D absorption, then all this thing will lead to increased production of one hormone that is called the parathyroid hormone. Increased parathyroid hormone will cause more damage to the bone. So that's a, the cycle starts. Kidney failure leads to low calcium, low vitamin D. Low calcium, low vitamin D increases one hormone that is parathyroid. Parathyroid then causes uh, direct bone damage. Low calcium causes damage. Low formation of vitamin D3 from the bone causes damage. So all those who have kidney failure, particularly early in their life, they say in their say teens or under 10 years of age, they have this rickets. You might have seen the bowing and deformities of the bones, various deformities in the bones. And those who are like in 20, 30s, 40s, the bones are already formed. They would have weak bone and the persistent bone pains and the muscle pains. So apart from water retention, the kidney failure patient would have low hemoglobin. They would have severe bone pains and the bone deformity. And obviously, the blood pressure will start shooting up. In fact, you can say the first symptoms of kidney failure is hypertension. Much before any abnormality one can see, the blood pressure will go up. And this is because there is excessive production of one hormone or the activation of the renin angiotensin system. And these are all obvious things. The swelling, anemia, bone deformities. Apart from that, there would be retention of various toxins, difficulty in removing acids, and difficulty in excreting many medicine which many of the patient might be taking at that time. So there would be the medicine either working excessively or will not work at all, or there is accumulation of acid. It will further deteriorate your heart's function, your the other organs function, and the retention of toxin will decrease the appetite, will cause a lot of other issues as well, right? Particularly like dryness of the skin, itching in the skin, regular continuous condition called pruritus, where the continuous itching in the skin, small boils in the skin. This all because of excessive retention of the waste products. These are all the signs and symptoms of the kidney failure. Now I'll tell you about the stages of the kidney failure. The kidney failure is divided into 5 stages depending on the loss of function. Stage 1, when the loss of function is the part of the kidney is functioning around 90% or more. But because of some reason in ultrasound or by other reason, the kidney has high chances of further deterioration. That's a stage 1. The stage 2, when the function of the kidney is around 60 to 90%. And then stage 3, when the kidney's function is around 30 to 60%. And the stage 4, when the function is around 15 to 30%. And then once the kidney function is less than 15%, that's called the end stage kidney failure. This is where most of the patient who they need dialysis or the transplant. And in stage 3 to stage 4 to stage 5, in stage 1 and stage 2, many of the patient will not have symptoms at all pertaining to kidney disease. But stage 3, stage 4, the symptoms will start in few patients. The symptoms will start little earlier. A few patients will have symptoms little later. But stage 3, stage 4, many of them would have hypertension. Their hemoglobin level will go down. The bone deformities or the bone pain will start. And the stage 5 is the stage where if intervention in the form of transplant or the dialysis, if not done, then the person life or the patient life will reduce. Look at this figure. There's a global prevalence of the chronic kidney disease. 1 in 5 men and 1 in 4 women, they have some or other kidney related issue if they are in that age bracket of 65 to 74 years. And when the bracket age group goes to 75, it becomes 2 in 5 and the 3 in 5 women and 2 in 5 men, they have some or other kidney problem. Because as age increases, kidney function automatically reduces 10% in every decade of your life. So it's a big figure. Look at this. This is Indian figure. It's a rough estimate that 1 out of 10 Indians have kidney dysfunction. And if you want to see it in some solid figure, you can see this: the 5 lakh Indians believed to be in the need of dialysis. You mean the dialysis means that someone who is having kidney failure more than 85%. The number of deaths attributed to CKD, it's increasing rapidly. In the 2016 figure, you can see more than around 1.25 million people have died because of kidney failure. Look at this figure of the map of India. The age-adjusted death rates very high, and particularly in southern part of India because of kidney dysfunction. So kidney dysfunction or the kidney failure is not something which is very uncommon and happens to only those who are elderly or those who have diabetes or those who have hypertension. You can see the figure. It's happening in I'll show you the cartoon. It's published in Times of India. And the headline says that silent killer. It strikes without warning, because until unless someone reaches into stage 4 or 5, they will hardly have any symptoms. And the same study says there are near about 1 crore existing CKD cases, and every year 1 lakh new cases are being added to this existing pool. A huge number of patients are having kidney problem. And look at this, the worrisome fact is the kidney failure patients are getting younger day by day. Now that previously they used to be of 40 to 50 or 60 years of age. Now the even 30, 40 years of the patient of 30 or 40 years, they are also having kidney failure, and good chunk of them, near about 40 to 45% of our kidney failure patient now belong to in this age group. Look, you can just guess what would be the problem that person would be facing now, because it's the beginning of his productive age. The 30 to 35, 40 years, the beginning of someone's productive age, someone's family, and so many people are dependent on him, the entire family, parents, everyone. And kidney failure in this way will not only destroy that person, it will destroy the entire family. So kidney failure, which is common, it's not that it's happening only to very few selected patients. I have shown you the figure, and I have shown you the mortality rate also. If the kidney failure patients are not taken care properly, or not segregated, not attended, or not being followed up regularly, many of them, it's become very difficult for them to see or go beyond 5 years of having kidney failure and stage kidney failure. What are the main causes of kidney failure? all of you know that diabetes, particularly uncontrolled diabetes, high blood pressure, that again uncontrolled blood pressure, these are the two main reasons for the kidney failure. Apart from that, nowadays we see obesity, uh, increased cholesterol or the lipid levels in your body, excessive exposure to some toxin in the form of herbs, in the form of some food, in the form of some alternative medication, in the form of some recreational drug abuses, excessive alcohol, smoking. These are all regular causes of kidney dysfunction. Apart from that, there are few diseases which are regularly affecting kidney. Out of that, some autoimmune disease like SLE, it is important. And then you have some very kidney specific diseases like glomerulonephritis, some tubulointerstitial nephritis, or the kidney failure because of stone formation, kidney failure because of infections in the kidney failure because of kidneys, anatomical abnormalities, like some genetic abnormality. Condition is called autosomal dominant polycystic kidney disease. Apart from that, the regular infection anywhere else in your body can also um, disturb your kidneys. Sleep apnea can, if someone has kidney problem and having sleep apnea, that can also directly aggravate the kidneys condition. What is the treatment of it? The treatment in initial stages, stage 1, stage 2, the treatment is only keep checking the kidneys function. If someone has diabetes, someone has blood pressure, try to control that. Apart from that, there is nothing else from a medicine point of view. But once that person reaches into stage 3, 4, then he needs periodic and regular follow-up, regular visit to clinic, to the nephrologist, regular investigation, and as and when abnormalities come, we assess the level of hemoglobin, the health of your bone, the condition of your blood pressure, the level of the toxin that person has retained, the level of acids in the blood, and everything. And his treatment is given according to that. Try to neutralize the acid, try to neutralize the toxin products, improve hemoglobin. We try giving them missing hormone supplement like erythropoietin, vitamin D, and all those stuff. And once the kidney failure is more than 85%, then it's very difficult for those patients to maintain their life or the productive life with medicines alone. And those patients, we start the intervention in the form of either dialysis or the transplant. The transplant is always a better option. For transplant, we do not see how symptomatic patient is. We see the patient, if someone has reached to the stage 5, and this kidney failure is irreversible failure, and sooner or later that patient is going to be symptomatic. The person can go for transplant, and the earlier transplant is done, better for that patient. The transplant is it's a big surgery, but it is not a complicated surgery. In transplant, what happens? We take a kidney either from a live donor or from a cadaver donor. Cadaver means someone who has died in the hospital and willing to give kidney. The kidney is taken from them, the live family donor, and the kidney is attached to a new location. You can see here, just close to the urinary bladder. This is a new kidney. The previous kidney or the old kidneys are in their place. This kidney is attached to the vessels here, and the ureter or the urine pipe is attached to the urinary bladder in a new location. So this is how the transplant is done. Before transplant, we run many investigations to see whether this transplant will be successful, and whether the kidney which we are taking is going to survive, and how long it's going to survive in this particular body. And we do see in our first priority is, if someone is a live donor, we see to it that because of kidney donation, the person who is donating kidney should not have any issue. No, and that person should not have any problem which can cause kidney damage also. So that, like, it should not happen that we remove kidney from his body and he later on he should develop kidney failure. So it's a big surgery, but it's not a complicated surgery. Number of investigations are done, but investigations are easily available. Reports are easily available. So it's a wonderful option for all those who have kidney failure, because it not only increases the lifespan of the kidney failure patient, but also increases the quality of life. If someone cannot go for the transplant, then the other options left is hemodialysis or peritoneal dialysis. Hemodialysis is something where the blood is filtered in a similar way what your native kidney does. The blood is filtered and then returned back to the circulation. The blood is taken out, it goes into a machine that's called a dialysis machine. There is a artificial kidney that's called dialyzer. It goes into the dialyzer, it gets filtered there, and the filtered or the pure blood is returned back to the patient. Thus, this cycle they have to do minimum 12 hours in a week time. So it's like every alternate day they have to come to the hospital, get it done, and then they go back. This can be done at home also. Another option with the kidney failure patient is peritoneal dialysis. Peritoneal dialysis is something which can be done at home, and it's done for those who are like in their extreme age group, like less than 10, less than 15 years of age, or more than 70, 75 years of age, 80 years of age, or those who are like on a job or in a situation where they cannot come to hospital for dialysis quite often, and they don't want pricks and all, they don't want to do anything with the blood. So this is a wonderful option for them. This is called the peritoneal dialysis. Here what we do, we instilled a special fluid in the patient abdomen, and this fluid, it attracts impurity from the blood. It collects impurity from the blood which is flowing in the abdomen. It collects it, attracts it, collects in the abdomen, and then this collected fluid is drained out. And then this is has to be done quite frequently. And it's something like it can be done manually also, the patient or the patient attender can do, or it can be done with the help of a machine. That's called the CCPD. And that is like people come back home from their job, and before going to bed, they just connect this tube which is coming out of the abdomen to the machine, and the machine keeps doing dialysis till you wake up. And you come to know, you sleep, or the patient sleep normally. As they sleep, they can in between, if they want to get up, they do get up, go for their go to washroom, whatever little job they want to do, go back and sleep, and the machine keeps doing dialysis. The next day they are free, they do their normal chores. This is how the peritoneal dialysis is done. Then the diagnosis of kidney disease. Many of you must be thinking how to diagnose it little early, because once someone reaches into the stage 4 or stage 5, it's very difficult to reverse kidney from that stage. But earlier earlier someone is diagnosed, it's better for him, and then we can increase the lifespan of the kidney, or decrease the pace of deterioration of the kidney's function. So the kidney function is basically, kidney health can be easily detected by simple blood tests, simple urine tests. Blood test, what we do, where we check serum creatinine, which is easily available. It's very cheap investigation, available everywhere across the country. And urine, we see, is there any protein coming out of the kidney? Is there any blood coming out of the kidney? basically we look for the quality of the urine, because the normal kidney does not allow any protein or any blood cells or any other important electrolytes in the urine. If someone has less calcium, the kidney will not allow, kidney will not allow calcium to come out in the urine. Similarly, other sorts, if in spite of having less amount in the blood, if urine is allowing it to drain out, the kidney is allowing it to come out in the urine, it means there is some problem in the kidney. So urine analysis is done. Urine analysis, again, it's a very simple investigation, very it's not costly, easily available everywhere, and available everywhere, in fact. So the two investigation, the blood test where we see the creatinine, and the urine, where simple urine analysis gives a 90% information about the kidney, and the rest other investigation is to just to confirm the kidney dysfunction. So for that we can go for the ultrasound, which will tell us that kidney is big or enlarged, or there is infection, there is some anatomical abnormality, or is there any ways by which kidneys can be corrected. Then there are some X-rays, and then CT scan, then MRI, and renogram. There are so many other investigation. We can go for the biopsy of the kidney also, if there is any confusion about the cause of the kidney failure. But to detect kidney dysfunction in its earlier stages, the simple investigation is urine and the blood or the serum creatinine. Those who have diabetes, those who have blood pressure, they should keep doing it and regularly, so that much before your diabetes damages your kidney, we will come to know. And how to prevent the kidney diseases. Kidney prevention, as I told you before, the number, if you see this 50-60% of our kidney patients are either diabetic or blood having hypertension. And out of that, the diabetic patients population is more. So if someone has diabetes, the primary, the important thing he has to do is to control the blood sugar. A target, it should be within target range. Excessive blood sugar above target range will keep getting accumulated in the kidney and different structures of the kidney, and later on this sugar which is accumulated in the kidney will not come out and will keep damaging your kidney. So if someone wants to prevent the kidney disease, kidney failure, and having diabetes, he has to buy anyhow, even if it's one medicine or four medicine, if it's drugs, tablets versus insulin, whatever, whichever way, and the sugar is controlled, it has to be that the medicine, or the number of medicine, or the insulin, one should go for it, because your endpoint, your target is the sugar has to be under control. If sugar is not under control, then definitely kidney will fail. Similarly, if someone is having blood pressure, try to figure out why they are having blood pressure. Is it because of kidney the dysfunction? If it's not because of kidney dysfunction, it's essential blood pressure, then they should try to control the blood pressure in this target range. Because as I've shown you in my initial PPT, kidneys are just bunch of extensive network of capillaries. Capillaries are very fragile structure, very thin layer, outer layer. So they cannot sustain the pressure of the blood. If it's in the ranges of 160, 170, 180, they get ruptured. And ultimately, once the good portion of the good number of capillaries are ruptured, the entire that glomeruli becomes sclerosed, and then kidney failure starts. Even once kidney failure sets in, and then you would try to control blood pressure, then probably you will not achieve that much benefit, because once it is damaged more than 60-70%, then it's a downhill course. So control of sugar and the control of blood pressure is very, very important, and a regular checkup. Make it a habit that the way you check your sugar, the way you check your lipids, the BP and all. Make it a point that if particularly those who falls in that high risk category, those who are elderly, having family history of kidney failure, they should do their annual routine checkup. That would not cost them more than 200 to 50 rupees, but at least annually, or if the reports are on borderline, they should do it 6 monthly or so. And if there is any doubt, they must meet a physician and then show the reports to them. So regular checkup, controlling blood sugar, blood pressure, that's very important. And obviously, maintaining healthy lifestyle, and that includes stop smoking, alcohol, all the junk food, excessive salt intake, all the thing, because salt, smoking, they have direct bearing on the kidneys. Except the kidneys are not meant to preserve too much of salt. A kidney cannot handle salt quite precisely if you're taking too much of that. And all that will keep retaining in your body. And once it starts, the salt retention starts, then the blood pressure starts, and after that it becomes a vicious cycle only. We have seen, in fact, in India, there's a very peculiar thing that near about 20-30 percent of the kidney failure patients pool, we do not find any reason why the kidney has failed. There was no diabetes, blood pressure, genetic causes, nothing. It's called the not otherwise specified reason for kidney fail. And we have come to know that's because of misuse of many a times herbs, many a time different protein supplements, drinking water, having good amount of hardness or lots of minerals in that, pollution. So these are all probable causes of kidney failure. So if one has to, if one wants to protect the kidneys' health, they should not go for all this untested on an unexperimental medicine, particularly herbs. There are so many indigenous medicines, so many protein products, so many animal products. People take it on the counter without any prescription. They are not good for your liver as well as for your kidneys. Try to avoid all those products as long as possible. Another important thing, try to reduce the intake of salt. You can use spices instead of salt, and try to eat food which are made up of whole grain, and instead of having refined food, we try to make it a habit of eating a whole grain food. Try to drink good amount of water, near about say 2 to 2.5 liters of water in a day. And then this drinking should happen over a period of 17, 18 hours. It should not be like this. People drink 1 liter in the morning, 1 liter in the evening. Throughout the period, you have to keep yourself hydrated. Should not hold your urine unnecessary for a long time if there is a possibility. So these are all important tips which can make your kidney more healthy, particularly controlling sugar, controlling blood pressure, controlling your salt intake. Do not take any herbs, any minerals, any painkillers, smoking, alcohol has to be curtailed or modified, so that you can live longer and live longer with healthy kidneys. Thank you.